When we look at the cases where we did it, so children with no big improvement in seizure frequency after the diet, but we still attempted to wean medications, we realized that in the vast majority of them, this was successful.
Wow. Fellow Homo sapiens, my name is Torie Robinson and welcome back to Epilepsy Sparks Insights. The more we learn about the ketogenic diet, the more we learn of its correlations with improvements in things other than potential seizure control, such as improved mood and alertness. Today we hear from the brilliant paediatric neurologist Maria Gogou, who in part 1 of 2 shares with us how that she has learned that sometimes it can be worth a person staying on the diet even when it hasn't improved their seizure control. Please don't forget to share your thoughts on this episode with us in the comments below, like the episode and do subscribe so that we can educate and empower both more people affected by the epilepsies and indeed more clinicians with patients who have an epilepsy to provide the best care possible.
So my name is Maria Gogou and I'm a paediatric neurologist trained in London at Greater Ormond Street Hospital and at the Evelina Children's Hospital with a special interest on complex and rare epilepsies. Currently, I'm back in my home country, in Greece, and work as a consultant pediatric neurologist in a university hospital in a city called Alexandroupolis in the northern part of the country.
Why did you become a paediatric neurologist and why did you focus on rare and complex epilepsies?
Well, soon after my graduation from medical school, I completed a PhD focused on sleep disorders among children with genetic epilepsies. So I was touched by some very special features of those patients, like coping with uncertainty and this disruptive nature of their disease. So I felt the need to dig deeper into their needs. And from this point of view, I would say that my interest in epilepsy pushed me to become a pediatric neurologist as well.
And you're still doing it, so it must be it is an ongoing, like almost exciting, complex area of medicine, forever changing, right?
Exactly, and I would highlight the ever changing because there's so much progress and it's exciting, but at the same time very challenging and tricky sometimes to keep up with everything new which comes to the light. But I would say that I'm learning many things every day from my interaction with my patients. So I would say that epilepsy management is somehow a part of my life.
Any families, patients who hear that, see we have someone completely dedicated to your quality of life. And quality of life is a huge, huge thing, right? It's not just about seizure control.
Exactly. My work with the patients with complex epilepsy made me realize that. So when I was a young doctor in training in epileptology, I used to focus on seizure frequency and the impact of treatments on the seizure burden, so on the number of seizures someone is having. But soon I realized that this was not always the case, and there were a number of additional things which mattered. And I will never forget one day in one of the ketogenic diet clinics I used to do, I was discussing with the father of a lovely little child about the impact of the diet. And I realized that actually there was no change in seizure frequency. She still kept on having seizures. And very spontaneously, as a young doctor, I said, okay, so there is no benefit actually from the diet. And I received the answer from the father, oh no, of course there is. We have been able to reduce a number of your medications. Things are much better now. So this, rang a bell. I felt like, what happened? I missed the point. And beyond seizure frequency, weaning of anti-seizure medications after a new treatment approach can also be a therapeutic goal. And this pushed me and my colleagues, I worked at Greater Ormond Street at that time, to investigate this in more depth. And so we conducted a project looking at weaning of anti-seizure medications in children after starting them on the ketogenic diet. The inspiration for this work was the feedback from many families that they felt that reducing one or more of the previously used anti-seizure medications could be an additional benefit after the onset of the diet. And we realized that we don't very systematically discuss it in clinics. So we spend a lot of time, and this is reflected in clinical letters and discharge summaries as well. We spend a lot of time discussing new medications and new treatment approaches, and we make new suggestions. We don't spend equal time discussing weaning of medication which hasn't worked, weaning of medication which the patient doesn't need anymore, or weaning of medication which can be associated with side effects sometimes. And we say that if the ketogenic diet is as effective as a medication, why not considering weaning, reducing the total number of the other medications once the diet has been established? So we looked back at the patients started on the ketogenic diet during a 5-year time period, and we realized that we actually discussed about and attempting weaning of one or more medications in about 3/4 of them. And those patients in whom we attempted weaning one or more medications, they were mainly children who had responded well to the diet, which meant that they had experienced an at least 50% reduction in the seizure frequency. And once attempted, weaning was actually successful in 2/3 of them, so a quite big number. And when I say successful, I mean that we didn't have to restart the medication or start or introduce another medication. On the other hand, we also looked at children who had not responded to the diet, so they had not experienced any significant improvement in their seizures, which can happen many times. In those cases, we didn't consider frequently weaning of anti-seizure medications. However, when we look at the cases where we did it, so children with no big improvement in seizure frequency after the diet, but we still attempted to wean medications, we realized that in the vast majority of them, this was successful.
Wow.
So this was interesting because if seizure frequency doesn't preclude the outcome of weaning one anti-seizure medication, why not discussing that earlier? Why not considering that in patients who haven't had, an impressive improvement in their seizure frequency? So this was actually a very interesting point, which made us also change our everyday practice in clinics. So now we have a template for every child starting on the diet, where we record the baseline visit and all follow-up clinic visits. And now the idea of weaning one or more medications is introduced from the very beginning as a potential therapeutic goal. But also there is a gentle reminder in every of the follow-up visits. So is this patient eligible for weaning of one of the previous medications? What do the families think? And what do the patients say, of course?
So just to clarify, so sometimes about a third of patients do not have their seizures controlled by the ketogenic diet, right? But despite that, you may be able to still start weaning them off their anti-seizure medications.
Exactly. So the success or not of weaning at least one anti-seizure medication doesn't solely depend on the improvement of the seizure frequency.
And do you think that that is a result of the ketogenic diet, which doesn't appear overtly to have a positive impact on seizure reduction? Or could it be that they were on too many drugs in the first place? What could it be?
I think that the ketogenic diet, as every other therapeutic intervention, can have benefits which are beyond the seizure frequency. So sometimes the seizure frequency remains the same, but seizures are much less intense. The seizures are shorter in duration, which means not a big need for frequent use of rescue medications, not frequent admissions. So this makes things more settled and gives the opportunity to clinicians and families and carers to consider reducing the total drug burden as well. So yes, there are benefits beyond the number of the seizures.
So that third of people that don't have their seizures controlled, they may still have benefits of the diet of impacting their quality of life.
Exactly, yes.
This is so cool. I just think it seems obvious when you say it, like what you have learned from this work. But I do think often clinicians just don't see beyond, okay, does this drug work? Let's try another drug. That's kind of, especially with short appointments. It's like we don't have enough time to think about this. And it's like, okay, try this one on top of that other one, maybe.
Yes, and this can also be in part due to a fragmented type of care. So medical wards can be busy. So there are changes in the doctors who cover for the patients. A patient can be admitted even in a specialized center, but may be seen by a doctor who is not very familiar with them because of gaps in the rotas and understaffing and all those things most of us are familiar with. So it is sometimes more straightforward to just suggest another medication, just to be on the safe side of things.
Supposedly safe.
Yes, so supposedly. This is another issue I will highlight. But not so easily consider weaning medications which do not work, which are not effective, actually. And when you said safe, this is completely true, because there is a number of side effects related to medications, including anti-seizure medications, and it's not uncommon for patients and families not to be aware of them at all. So I will not forget a couple of cases of patients of my own when I asked them, so are there any side effects after we have started this new medication? And they will say, no, it's okay. But when I move from an open to a closed question and I'm asking, have you noticed this change in your child or has this occurred? They are surprised and say, oh yes, was this a side effect? Could this be related to the medication? We had never thought about that before. So I think we need to educate families and patients more around anti-seizure medication issues and the side effects they could expect.
I just think that's so important. I'm thinking of personal experience as well. It's so important, I think, often for parents and carers in general to be just more aware of any little changes, because especially if you're a child and especially if you have some intellectual disability or cognitive issues, it's even more important for mum and dad, if you have both, if you're lucky, or whoever's looking after you, to notice subtle differences. So subtle, because, and especially when they're little, you just kind of accept awfulness. You don't challenge it. It just happens. And they're like, okay, this is how I feel now. And yeah, and you need to know about that, but the clinicians need to ask the right questions in the right way.
Exactly, you're absolutely right. And I think this also reflects the quality of the relationship between the clinician and the patient and the family. So is this a trust-based relationship, and how much engaged and involved are families in decision making? So yes, weaning of anti-seizure medications requires a good and trustful relationship with between clinicians and patients.
Okay, well, everyone look up this cool paper, Anti-seizure Medication Reduction and Withdrawal in Children with Drug-Resistant Epilepsy After Starting the Ketogenic Diet. Whew.
It's published in Developmental Medicine and Child Neurology, so they can have a look at this. And actually, this work we made in this field inspired us to go one step forward and looked at another group of patients who have seizures, but they may not really need anti-seizure medications for long. And I refer to patients who experience acute symptomatic seizures.
And there is our topic for next week with Maria. Thank you so much to Maria for her top-notch insight into the potential impacts of the ketogenic diet other than seizure control, and why this must be valued by clinicians if we also value a person's quality of life. Get ready for part 2 with Maria next week, where, you guessed it, we talk about acute symptomatic seizures. Do check out Maria's mentioned paper and more about her work on the website torierobinson.com, where you can also access the podcast, the video and the transcription of this episode. And if you haven't already, don't forget to like, comment and subscribe to the channel, and share this episode with your friends, colleagues, family members, and see you next week.